Hi, welcome. I'm Peggy Oliveira. Today's question came from Linda, and Linda shared a little bit of a backstory, but she was wondering if I had any tips for trauma survivors going to the doctor. And she mentioned a gynecologist in particular, but I know that going to the doctor, really any kind of doctor, for a trauma survivor can be pretty challenging. Dentists, anybody that's touching you, anybody that's asking you questions about things that may bring up stuff. So I'm going to address specifically the gynecological aspect of it, but much of what I'm talking about is really relevant no matter what kind of doctor you're seeing, or even like a massage therapist or a chiropractor, something like that. So first, know, Linda, that you're not alone. In fact, I'm pretty sure that most of you watching this have struggled in some way with maybe a particular type of doctor appointment or dentist, because there's something about it that feels a little familiar that's connected to the trauma, whether it's being touched in a particular way or in a particular place, not having a level of control. But there's different pieces that can feel familiar, it can feel uncomfortable, it can bring up shame. So I would say gynecologists and dentists tend to be the most significant things that people share with me. With a dentist, part of that is the oral aspect of it, having your mouth open, having somebody put their hands and tools into your mouth can be very triggering. And gynecology for kind of also maybe some obvious reasons. So there's knowing that you're not alone is really important. Just please know that you're not alone. Don't feel bad about the fact that you struggle with going to these appointments or how you feel in these appointments. Really, let yourself take that in. There's nothing to feel bad about. Also know that there's a reason that it's normal for people to struggle. Even if on a conscious level you are very aware that the likelihood of this person doing something to hurt you is not likely, your body doesn't know the difference. Going to the doctor itself is quite a vulnerable experience. If you think about it, most doctors that we go to, we often remove part of our clothing. That obviously is incredibly vulnerable for a particularly sexual trauma survivor. So just recognizing you're not alone. There are very valid reasons why you might struggle. Reminding yourself why you're doing it. Reminding yourself that you are in control. I know doctors have a lot of power. We kind of feel very removed from their expertise and their authority. But you are still the one in control. You get to make that decision. So reminding yourself that what you're doing is something that you get to choose to do, which is very different than your experience when you were traumatized. So recognizing the control that you have in that, the choice that you get to make in doing that, reminding yourself that you're doing this because you are honoring yourself. You're taking care of yourself. You're taking care of your well-being, your medical circumstance, your concern that's going on, your health, your well-being. Reminding yourself of those things can be helpful because it helps you reconnect with the fact that it is your choice, that you are doing something that is for the betterment of your well-being, that you're taking care of yourself and that you deserve to be taken care of. So you're consciously reminding yourself in your thoughts and in your body that this is not at all the same as it was when you were traumatized. Now, that's not magically going to make all that stress and uncertainty disappear. But if you continue to remind yourself of that, reminding yourself that it's a safe place, that this is a doctor and you're choosing it, hopefully, particularly if it's a gynecology appointment or even a dental appointment, usually there is somebody else in the room, or you can request to have somebody else in the room. I'm going to talk more about that in a moment. But really reminding yourself, just talking yourself through it, that you're choosing it, that it's good for you, can be helpful. The more you practice that, the more benefit there is. I think it's also really important to remind yourself that this is an important place to practice honoring yourself and your boundaries. So I just mentioned being able to ask to have somebody else in the room. That is completely within your right, at least here in the US, and I believe most other countries. You should likely have a right to ask that somebody else be in the room. There's nothing wrong with that. In fact, a lot of gynecologists' offices require that there be 2 people in the room. In most dental situations, there's often an assistant and the physician or the doctor, the dentist that's there, so there's 2 people in the room. So you can ask for that. You can ask for what will help you feel comfortable, even if you don't know exactly what that is. Being able to share with your doctor that you're nervous, that you're uncomfortable, that you're a trauma survivor, and you might be triggered. I know that for so many people that feels embarrassing to say, but there is nothing to be embarrassed about. Absolutely nothing. And it's really quite unfortunate that doctors and dentists are not trained. They're not trauma informed. That is slowly beginning to change, I believe, but that's the reality. And we shouldn't have to do it, but we have a right and we have a responsibility to ourselves to honor what is present for us. So for example, if you're going to a gynecologist and you know that you're going to feel really uncomfortable, you could just casually say, I'm really uncomfortable about this. You don't have to say that you're a trauma survivor, but you can. Sometimes having context can be helpful for a doctor to know. So being able to say, I'm really uncomfortable with this. I'm a trauma survivor and I'm afraid I'm going to be triggered. Hopefully, most doctors will maybe even ask you to share a little bit more just so that they have a better understanding. But you can then let them know if something is uncomfortable, if something feels triggering, if something is painful, whether you have a trauma history or not. If something is painful, please speak up. Please tell your doctor that it hurts, that it's uncomfortable. Is there a different way that you can do it? You have a responsibility to yourself to honor that within you, to speak up, to ask for what you need. It's not easy. I'm not at all suggesting that it is. But sometimes we can get caught up in feeling like there's something wrong with asking. And please take from this that there is nothing wrong with asking, and you have a right to ask, and you have a responsibility to yourself and your well-being to be able to do that. If they're in the middle of a procedure and something isn't feeling good, you can ask them to stop or give you a moment. Or if needed, to stop and reschedule the appointment. With dentists, often It can feel really difficult because you don't have the ability to really speak if their hands are in your mouth, or they've got your mouth pried open. That can be really challenging because that can feel very familiar in terms of like not having a voice, not being able to say anything. But before you even sit in that chair, before they even start to do anything, as they put that little thing around you, being able to say, I'm feeling really nervous about this appointment today. So if I might ask to stop, or I might ask for a moment. That's okay. It's important to do that for yourself. So recognizing that you're choosing to do this for your well-being, that you have the opportunity to be able to speak up for yourself. Even if you don't feel comfortable doing it, just recognizing that you have the ability to do that. You have some power in that situation. In fact, in most ways, you have complete power. Maybe sharing with the doctor, if it's comfortable to you, that you're a trauma survivor. And you can say, I feel nervous about this, or I'm a little concerned that this might be triggering to me because I'm a trauma survivor. You can say something like that. Doctors are used to hearing all kinds of things. And again, hopefully, there won't be any pushback with that. Hopefully, there's enough information out there now that even if they don't really know exactly how to address it, they'll at least be mindful enough to know to let you kind of guide it. And the reality is, I can't speak to other countries, but generally speaking in the US, doctors are not very well trained when it comes to interpersonal interaction. The whole bedside manner thing is they're not trained very well in that. And they're certainly not trained in understanding even beyond trauma. They're not trained in that, but even just for an average person, the kinds of things that can come up. If anything feels painful to you, and maybe it feels painful, well, there's a lot of reasons that it can feel painful, and it may be very specifically related to your trauma, like maybe there's an injury or something like that, or it could be more that your body is in a stress response, and so your muscles are constricted, your tension, there's tension that's there, and anything where, like even your jaw at a dentist's office, if you're feeling really tense, then your jaw muscles are going to be really contracted. And so if you're trying to hold your mouth open for an extended period of time, there's a good chance that you're going to end up not feeling well. You might have actually a lot of pain or a headache as a result of that. So if pain is present, don't try to tough it out. Be gentle with yourself and be able to say, or work towards being able to say, I need a minute. This is painful. Can we stop? Or is there another way to do this? It's important to be able to do that, and I know that it's not easy. Honoring yourself in these moments actually can be very healing as you experience it, even if it feels uncomfortable. It actually can be very healing because you are honoring what is present for you. You're taking care of yourself in those moments. I know it's not easy, but you can work towards doing it. And maybe having somebody in the room with you might be helpful. You can ask for that. I know with COVID, there might be a little bit of difficulty with that. But some doctors and dentists are pretty open in terms of their services right now. So you might be able to have somebody in the room with you if that feels good. Maybe you have something that you can hold on to with your hands to squeeze to help just kind of brace yourself a little bit. Also, doing some things before you actually go to the doctor. might be helpful. Again, reminding yourself that you're making a choice, you're doing this for your own benefit, that you get to control how it unfolds, but also doing some things that can help with relaxing your body. So maybe progressive relaxation, where you go from tip to toe, from the top of your head all the way down to your toes, kind of incrementally maybe tensing up your body or that particular part of your body where you're focused, and then releasing. So like even being able to clench your jaw, like tighten all these muscles in your jaw area, and doing that for just a few seconds, and then very intentionally, consciously releasing those muscles and kind of breathing, exhaling as you release those muscles, and then moving down into your neck area where you tense up your neck. Ideally, maybe you'd be laying down if that feels okay as you do this. So you tense up your neck for a few seconds, and then you very slowly and intentionally release the tension in your neck, tightening up your shoulders and holding that for a few seconds and then releasing. So, and then you just do that incrementally down through your body, in your shoulders, your arms, your hands, like you clench your fists, in your belly, in your hips, like feeling the sense of tension in your hips and then releasing your thighs, your feet, like maybe even flexing your foot and holding that and then releasing it and letting it relax. If breathing meditation works for you, doing those kinds of things before you go in can help your body and your nervous system get into a state of calm instead of all that fear that might be going through your mind and body about the appointment. So again, reminding yourself, it's natural to struggle with some of these appointments. Some appointments, some doctors, some types of visits may be no problem whatsoever. And maybe even a gynecologist appointment on occasion doesn't affect you at all. But maybe on a particular day, because of all kinds of other things that might be going on, maybe it feels a lot more challenging. But please honor yourself by getting the medical attention that you need, whether it's a routine visit or something that is going on within your body that needs to be addressed. I know it can be challenging. I know that it can be. I've struggled in different ways at different times. And I've known so many people, most of the people that I work with, struggle with it. But it is something that you can begin to work through so that you don't always have to struggle with it. So you can go and get the care that you need. I have known so many women over the years who avoid going to the dentist and then end up getting infections. I've known women that have had pain, gynecological pain or breast pain, and struggled and put it off and ended up having even more issues than they would have if they had been able to go. And that's not blaming anybody, but I just don't want you to put off the attention that you need. You deserve to be taken care of. Your body deserves to have the needs that it has met. If you're not feeling well, if there's pain, or if it is just an important routine visit, you deserve that. You deserve to be taken care of. And you deserve to have your needs met in those moments. You have a right to speak up for yourself and ask for what you need. You have a right to be able to say, hold on, I need to stop. Urologist is another appointment that can be really challenging. Again, probably for obvious reasons. And obviously I go to all these kinds of appointments. I've been to a urologist as well. And I actually ended up saying to the assistant, like, this could be really triggering for a trauma survivor. Are you trained in this at all? And no, when she was just so kind of robotic and didn't even like ask why I might say something like that. It was just a very disconnected and dismissive kind of experience. I wasn't triggered or anything like that, but there's a reason that those kind of appointments can be challenging. And the more tense you feel in your body, the more fear that you have, the more shame that is present for you. And whether that's shame because it reminds you of other things that you feel shame about, or shame because you're worried that it's going to be a difficult appointment. And anytime shame shows up, it's connected to all the other shame that you feel. It can make it more challenging. So the more that you can take care of yourself beforehand, the better it will be. And again, it's not magically going to change anything the first time, but the more you practice it, the more benefit there is. So please know that you're not alone. Please get the care that you need, that you deserve. You are on this healing journey for a reason. You want to be healthy. When you continue to make progress, when you're ready to show up with a confidence that's already within you, but is all clouded over right now, when you're ready to stand proudly in that, you don't want to have to worry about health issues that might creep up because you're not taking care of yourself. Take care of yourself now, so that as you continue to journey up that mountain, you feel ready, physically, emotionally. You are healthy and happy and whole. Thanks for watching. If you have a question, feel free to share it with me at qanda@courageousjourneys.com. That's QANDA@courageousjourneys.com. And I will look forward to answering your question. Of course, if you're not subscribed, please do so and make sure to click on the bell for notifications. Thanks for joining me. I will look forward to seeing you next time.